Good afternoon, Dr. Fauci. Thank you so much for being here with us today.
My pleasure.
So, COVID-19 was characterized by a lot of remarkable successes in the fields of scientific and technological advancement. It also highlighted the importance of a multidisciplinary approach involving transversal collaboration across different sectors. In your opinion, what kind of multidisciplinary training do future scientists need to receive to be better prepared for the next pandemic?
Well, it's very, very clear that when you have something as complicated as a pandemic, it goes beyond one discipline. You have to have the collaboration and cooperation of epidemiologists, of virologists, of immunologists, but also data scientists. One of the things we learned with all of the variants that came about and how this virus was so elusive in eluding away from the ability of the immune system to recognize and suppress it, we had to understand the complexity of data analysis. So I think if someone wants to really address in an adequate way emerging and re-emerging infections, by definition, it has to be a multidisciplinary approach, because one particular group working in a siloed way would take much, much longer to get to the solution than a multidisciplinary approach. So right now, when we look forward to training students and fellows, we've got to make sure they understand the multidisciplinary nature of what we're dealing with.
And during the pandemic, we saw many instances of institutional weakness, hesitancy, and mismanagement. Now, we know that policymakers rely, or at least should rely, on scientists. And at the same time, science should not ignore the societal and economic challenges that come with emerging infectious diseases. So how can we train scientists on these aspects to better guide and inform the actions of leaders and decision makers?
Well, I think it's important for scientists to realize that they need to stick with the science. They can get involved in informing policy, but what sometimes scientists don't appreciate is there's a big difference between policy and politics. So scientists need to stay out of politics and give the information that is necessary for people who have responsibility that goes beyond science, that need to make responsibility and decisions regarding economics, regarding schoolings, regarding social issues. The scientists put in input that's based purely on science, but they need to then make sure that there is a multifaceted analysis of what they're going to do with those science and whether or not the risk-benefit ratio of a public health endeavor is really worth it. And often scientists themselves, who are focused predominantly on science, need input from other elements in society, because scientists can't operate alone in a vacuum, because there are so many other concepts in society that need to be addressed and at least taken into serious consideration.
And in fact, one of the biggest challenges of the last pandemic has been communication, especially communication with the general public. On the one hand, we had misinformation and disinformation spreading at alarming rates, and on the other, recommendation of scientists and public health workers evolved and changed as our knowledge grew. Yeah. And this created mistrust towards science. Yeah. How can we train scientists to communicate better? Do we need to be more transparent, more humble, or more assertive, on the contrary?
All of the above.
Okay.
So this is, I think, one of the really important lessons that we learned from COVID is just what you're saying. With COVID, we were dealing with a moving target. What we knew in January of 2020 was different than what we learned in February and in March and in April. And what scientists need to be able to communicate better, that science is a process to allow you to get and accumulate evidence, data, so that you can make recommendations based on the evidence that you have at a given time. We've got to get the general public to realize that as the information changes, your communication, your recommendation, your guideline will change. If we give the impression that the biological sciences are immutable, that what you say in January is going to be absolutely the same as what you say in August. When you're dealing with an emerging outbreak, that almost never is the case. And I give a very simple comparison. When you're dealing with the mathematical sciences, 2 plus 2 equals 4 in January of 2020. 2 plus 2 equals 4 in December of 2023. Yeah. It doesn't change. But when you're dealing with a virus that continues to evolve, and our knowledge continues to evolve, scientists need to be communicating to the public that there are things that we don't know, and there's nothing wrong with admitting right now we don't know the answer, or we think we know this is what it is, but you have to keep an open mind that this might change in a month, 2 months, or in a year. That flexibility has to be communicated to the general public. Otherwise, they will lose faith in science and say, the scientists keep flip-flopping. They keep changing their minds. Scientists don't change their mind. The data changes, and you have to make your changes depending on what the data does.
That's an excellent point, and this is the first message that needs to come across, as a matter of fact, even before the actual facts and the data. So coming back to this really dynamic and broader vision of science, another sort of misconception is that whenever people think scientists, they immediately think labs and academia, but research for pandemic preparedness is much more than fundamental science. It requires collaboration with industrial partners throughout the process. How can we implement this vision starting from the very early stages of a scientific career?
Well, I think it's what you're suggesting that makes sure that when we train young scientists, they realize, that the days of the single scientist in the lab is history. It's beautiful history. Louis Pasteur in a room by himself. That doesn't happen very often anymore. No. Unfortunately, it doesn't happen anymore. What you have is a multidisciplinary approach now, because science is so sophisticated and so complicated that you've got to realize that you've got to collaborate and you've got to interact. And one of the most important interactions is what you mentioned, is that when you're dealing with the development of a product, there always has to be an industrial academic collaboration, public-private partnerships. The French government supports a researcher who makes a seminal discovery that would likely not go anywhere unless that person partners with a pharmaceutical company to make a product. So we've got to make sure our young scientists to realize that it's a very complicated, multifaceted process to get to the end game of what you want is to make an advance that benefits society. Very, very unusual that someone will do that alone in a vacuum. That almost never happens.
Okay, Dr. Fauci, it has been a real pleasure to discuss with you, and you are a source of inspiration for, myself, first of all, and for all the students who will be the scientists, the doctors, and leaders of tomorrow. So thank you once again for your time.
My pleasure.